Welcome to all of you. Greetings from Hyderabad, India. So, first of all, I would like to thank Medincedi and all of you for taking your time out of your busy schedules to have this interactive session. And let me introduce myself. I am Dr. Vamshi Krishnan. I am a consultant urologist and head of Department of Urology and Kidney Transplant at our hospital, which is Care Hospital in Hyderabad, Banjara Hills. So this is a team. We are a team, group of doctors working as a team. So the specialty of our team is we work in our own specialized subspecialties. So 6 of us work together. So this myself, I am more interested into lasers, endourology, laparoscopy, robotics, and also kidney transplant. I have a senior colleague with me. He is a very good surgeon in hypospadias, epispadias, and pediatric reconstructive urology. So I have a colleague, Dr. Arun Rathi, with me. So Dr. Arun is also a good endourologist and robotic surgeon. I have a colleague, Dr. Vascular, who is a trained uro-oncology. So uro-oncology is a subspecialty where the oncology of the urological organs, kidney, bladder, prostate, the urethra, so all these cancers of these organs are dealt by us specially. So we have a Dr. Priyank Salecha, who is an andrologist, and he is good in penile prosthetic implant procedures, testicular implants, male infertility. And we have Dr. Kirtana, who is a urogynecologist. She takes care of specific urological issues for female, like stress urinary incontinence, prolapse of the female genitalia requiring surgical interventions, and also some part of neurourology. So that way we are able to provide a subspecialty care as a team. So coming to what we do, most commonly we do the treatment of BPH, benign enlargement of prostate. So I am personally proud to share that all the advanced procedures for the surgical treatment of this condition, we are able to provide under one roof. So most of you may be aware TURP. TURP we don't do now. Because there are certain side effects and problems with it, like bleeding or incontinence or something. So we do a more precise procedure called laser enucleation, which we call as ultra-slim plug. And there are new procedures called RISM, Urolift, IT, and robotic assisted simple prostatectomy, which I will be subsequently elaborating. So this is ultra-slim plug, that is laser enucleation of prostate using an ultra-slim scope. Normally what we use is a 26 French scope, which can lead to significant strain on the urethra and the bleeding from the prostate. So this is a TRP where we put the scope and in bits and pieces we remove the gland. Whereas in laser enucleation in a single piece, like a patient having a 100 cc, 150 gram prostate or even more, this procedure is much safer. There is a laser fiber cutting the prostate tissue and separating with very minimal bleeding. Unlike, can we turn this slide off, please? So this is one of our flagship procedure which we are pioneered in our part of the country, and we conduct regular training workshops for other senior urologists and also proctor to other senior urologists in this procedure. So next we do a very advanced procedure called RISM. So this RISM is water vapor therapy. It's a daycare procedure. So here we put a scope and then we inject steam water vapor bubble into the prostate, and it causes tissue ischemia and necrosis, and then slowly the tissue will shrink. So this is a particularly useful procedure for either a very elderly person who is unfit for even the laser procedure, or a person who is younger and wants to retain his ejaculatory function. So which is usually lost after laser enucleation or TURP. So this is a daycare procedure. So this is a very good procedure for moderately larger prostates, like up to 60 grams or 70 grams. So whereas we have one more procedure similarly, this is much simpler than that. If a prostate is like this, we insert implants inside so that it opens away. This is particularly useful for smaller prostate glands, around 40 cc or less than 45 cc. This is much simpler, no heating, nothing, just implant the prostate and then in that way, so we can send the patient on the same day. It's a daycare procedure, and this can be done on patients. These two procedures, Reason and Urologist, can be done on patients who are on antiplatelet blood thinners. So that way, cardiac patients are benefited, which can continue antiplatelets and then do these procedures if there is a reason we cannot stop those things for them. So this is one advanced procedure. Next is a similar procedure called iTint. We insert an implant into the prostate and leave it for a week and then we remove. It's also a daycare procedure. This implant will create space in the prostate, which usually makes the person with a very small prostate, like a young person with bladder neck obstruction. This can lead to a good relief of the obstruction. So these are all the different prostate procedures. I did not show robotic simple prostatectomy due to paucity of time. Coming to stone procedures, I know most of you may be aware of this procedure called RIRS, retrograde intrarenal surgery, for stones, kidney stones. Similarly, again, when patients single kidney or patients cannot be dealt with PCNL, a percutaneous procedure, where we put a keyhole into the kidney that can lead to bleeding and all the problems. This RIRS can be done to release this laser that is caught in the stone into fine dust. So this is a photo of my patient who had he was on anticoagulant and antiplatelet due to cardiac conditions, and then we had to do RIRS in 2 sittings as it was a single kidney. So next, another stone procedure, we do a procedure called endoscopic combined intrarenal surgery, where one surgeon goes from below and then another surgeon goes from a keyhole, that is a PCNL. So this procedure gives access to all parts of the kidney with 2 different camera systems covering. So stones like a staghorn stone can be effectively dealt by this procedure. So apart from these, we also do certain laparoscopic or robotic procedure like anatrophic nephrolithotomy for certain indications for stone. So I did not mention the basic ureteroscopy and shock wave lithotripsy here because of paucity of time, but we also do that. So coming to laparoscopic urology, so we do both laparoscopy and robotic urology. This is the scope of surgery, what we do in our center. So including operative procedures like all kinds of nephrectomy, whether it is a simple nephrectomy or a radical for a cancer, partial nephrectomy for a cancer which is localized and we can save the kidney instead of removing the total kidney, and heavy nephrectomy in conditions where the tumor is involving up to half or sometimes there is a duplex moiety of the kidney, we can do heavy nephrectomy. Bladder cancer, we can do radical cystectomy, either laparoscopic or robotic. We quite commonly do radical prostatectomy for prostate cancers, particularly which is of higher incidence in people of African origin. So we see many of patients from Sudan, from Somalia coming with prostate cancer. We did a quite good number of patients having prostate cancer, and adrenalectomy, retropetal lymph node dissection. So among reconstruction, pyeloplasty, most of the times we do laparoscopically, it is easy to do. So sometimes we have to do a buccal graft ureteroplasty for a long segment ureteric stricture, or ureterocalycostomy, or ureteric repair, or reimplant, or if there is a VO or pediatric urology, we do retrosoraphy where there is a vesiculated reflux, we repair it. So there is a Bovary flap which I will show later. VVF repair. So we do, many people come for VVF, either it is a iatrogenic injury while gynecological procedure or even obstructed labor. So we do VVF repair by laparoscopic or robotic methods. Orchidopexy, congenital, and there is a procedure called metrophenol where we use an appendix to interpose between bladder and the skin to catheterize the bladder.